Hi, everybody. I'm Kevin Ressler. I'm the president and CEO of United Way of Lancaster County. I'm grateful to be here with you today and to host everyone throughout this day. We're going to welcome you here in a minute, but I want to introduce the two other faces you see on the screen are Patricia Espinosa Vargas. She is with 211 East, which is here housed in United Way of Lancaster and covers 7 counties, as well as Kristen Rotz, who is a colleague of mine from the CEO of United Way of Pennsylvania and co-host of today's event.
First and foremost, I want to stop and acknowledge the 211 team across the state who makes this work happen every single day. We've got a team of people positioned around the Commonwealth. They're answering the phones, they're updating our community resource data. I want to acknowledge all of the many partners in the nonprofit sector who help us update that information in our community resource database as well and help to make us the best that we can be. So as Kevin mentioned, we are constantly evolving and strengthening the 211 service across Pennsylvania.
We provide quality, and I'm just so proud of our team. They're highly trained. Many of us are certified in providing information referral to the community. We have intake specialists that are helping assess individuals that are in desperate need of housing and trying to connect them to those resources. But for anything else in the community, we are here to connect them to the services 24 hours, 7 days a week. It's a crucial service that we provide to the community. And as Kristen said, we are growing and more individuals are learning about us, but there's still that need to share and promote what 211 does.
Broadly speaking, one of the key goals of organizing this session is to collectively self-reflect on our equity and inclusion work and learn from each other's experiences to improve the impact of our equity work in the future. We are living through a special moment in history. A broader discussion is undergoing on the issues of racial equities and inequities. Brutal murder of George Floyd by police officers have jolted the nation and created an organic social movement around the notion of social justice and equity. In June 2020, a poll conducted by Ipsos, who are global market research and public opinion specialists, more than 70% of Americans described George Floyd's death as a murder. But as a nation, why do we have to wait for such severe and tragic incidents to pay attention to inequities that affects the lives of so many people around us? So these conversations are critical because historical and persistent patterns of systemic and institutional discrimination based on race, ethnicity, gender, ability, and other identities continue to undermine fairness of opportunity in our society. Therefore, at United Way, we are constantly and actively working against these inequities and injustices by challenging practices based on sexism, racism, and other historical and current forms of systemic discrimination. This includes addressing systems, policies, practices, belief systems, and attitudes that have often served to advantage some at the expense of others.
Challenge the status quo, whatever that is in your organization, in your family, in your faith-based community, in your social group. Challenge the status quo. We see ourselves as change agents because we are constantly identifying the pressing needs of our community, and we see our community as an ecosystem where intersectionality cannot be ignored. If one thing you do today, look up what intersectionality is and how that Venn diagram of the different circles layering over in your community have impact. If you say poverty is our focus, poverty is a major issue and a challenge where you are at. But if you see poverty and discrimination overlaying each other, it's going to be multiple times as hard. If you see poverty, discrimination, and trauma overlaid, it's going to be compounded. And as Kevin just mentioned, the aspects of social identity are very broad. It can be everything from gender, sexual orientation, race, disability, mental health, appearance. There's 27 different terms that I can throw out about one's social identity, and how they show up will also be how do we talk about marginalization within a community.
Also, locally with Lancaster City Council, we do find where mental health resources are very high priority right now. Many have asked and reached out to me to see where I would be able to find locations where they can go. That is a very big issue. That mostly in the homeless population in Lancaster is where I see that many wind up incarcerated because they are either agitated, they're mentally unstable. And I think that's where I find a roadblock sometimes. Although working in Lancaster General Health, we do have the ability to find and we ask those questions so we can continue finding ways to help, whether it's food resources, medical attention that they would need, or financial strains that they run into. So those are some of the qualities and things that we look for when patients come into Lancaster General, and also as your local legislator to help them.
2021, the United Way of Lancaster County 211 call service alone answered more than 40,000 contacts, many of which helped address needs directly related to COVID-19. Now residents in every county in the Commonwealth can access 211 services. But they're not just for pandemics, of course. 211 can help a family find childcare or housing information, so much else that 211 does. So we're grateful for all the work that's already taken place. I know that, Kevin, you were one of the people that helped me better understand the need to introduce specific legislation, the so-called HELP Act, the Human Services Emergency Logistics Program, and that's a long way of describing the HELP Act. This act would provide grants to 211 systems throughout the country to ensure comprehensive coverage with up-to-date information about mental health, substance use, housing, childcare, and so many other human services. Sometimes the biggest problem the biggest problem for most citizens is just getting the right information, talking to the right person, having the right phone number, having the right contact information. And 211 helps people in emergencies when they need information to get answers, to get help, to get the kind of information that all of us should have a right to expect.
Important to know. I think oftentimes our legislative offices, as the senator and representative both pointed out, end up being more like air traffic control. These individuals come in, they don't exactly know what services they might be eligible for or need. And that's really where we start working through it. And sometimes, what they originally come in for is actually a symptom to something else. It's not the actual issue at hand. And I know sometimes we see that in the Medicaid population. I know that Lancaster General did a great job with their super user program. And it turned out that some of the people coming to the hospital were coming to the hospital for, social reasons. They didn't have food at home, or they didn't have access to mental health services. And that's, I really think, where 211 is very helpful, because for us, it ends up being a one-stop shop. And many times, the individuals who come to the office may not even know that, the reasons or necessarily the actual services that might be available that we can help them with. And I think that's where 211 really shines, because you can say, okay, what are you dealing with? You're dealing with a homelessness issue, or you're dealing with access to certain services. Okay, well, we're going to get you here. And then sometimes while you have them, you're navigating them through that part, you find out that there's a couple other things that they also could benefit from. And I think that's a huge, huge value add for all of our constituents.
To conduct some COVID-19 impact studies on Pennsylvanians to get a test sample of what was truly happening throughout COVID-19 and for this ALICE population. The first study that we conducted was in August of 2020. So that would have been 6 months out from the initial start of the pandemic in March 2020. And one thing that we noticed is that 70% of respondents indicated changes in employment. This this reiterates the point that Alice is of that essential population when it comes to workers. So they were our childcare workers, they were our retail workers, they were our grocery store workers, and that for a time being, a lot of them had to lose their jobs because of the shift in what happened when things closed down. So that was a very eye-opening statistics to hear back from this survey. We also saw that 77% of respondents had 1 month or less of savings to cover basic household bills. This is really important because one of the things about this Alice population is that they are one financial crisis or one emergency away from falling into poverty. They don't have that savings safety net. And when you're living in a pandemic that we initially thought was only going to be 2 weeks, maybe a month, maybe 3 months, now it's we're 2 years almost into this. Not having a financial savings safety net is detrimental to this Alice population.
Now, we still have, and we are, looking forward to our third open enrollment here in Pennsylvania, November 1st of 2022 to January 15th of 2023. But during 2022, a special enrollment period exists that outside of open enrollment, Pennsylvanians have the ability to change a plan. If they have a qualifying life event, if they have a qualifying life event, and we'll cover those here in a second, they have the ability to enroll in coverage. And that is incredibly important, especially if people lose their job. If people qualified for Medicaid, but now they don't. Or if you have individuals who have changing life circumstances that we're going to take a look at in greater detail here in a second. Those qualifying life events will open up a special enrollment period during 2022.
So what we talk about a lot is a person-centered model. And what does that mean? What that means is that people are at the heart of what we do at 211 and what we do at the United Way. They're also at the heart of the call. So we have people that are calling in, our neighbors in the community, and we have specialists who are answering those calls. So there's a lot of heartbeats that are involved in this model and in this process. So when I was thinking today about the term person-centered, I think about how you call a service line, you call a customer service 800 number, and you get that long menu that no one wants to ever have to deal with, and you're pressing all these numbers, and you ask your friends, how do you get to a live person? What do I have to do to get to a live person? Because we all inherently need connection. We need to explain to a human, a live person, what's going on in our lives, and for them to anticipate what we need and to know how to respond to that, it's invaluable. And that's what an INR specialist, you'll hear different terms of what we call them, but it's really just the heart of 211, that person answering the call. They have so much training behind their trade